Okay, guys, so what is the difference between leukemia and lymphoma? Okay, so leukemia is basically neoplasm, or in which bone marrow is involved. So whenever you are asked about leukemia, bone marrow should be coming into your mind. So basically your cells or your abnormal cells or your tumor cells, your dysplastic cells हैं आपके पास, they are seen peripherally uh, on blood smear. ठीक है? However, in lymphoma, it is truly discrete, meaning they are basically arises from your lymph nodes. So let's talk about the lymphoma, and we are going to divide them into two: Hodgkin and non-Hodgkin. So Hodgkin's lymphoma have specialized type of cells known as the Reed-Sternberg cells. However, in non-Hodgkin, you have you don't have these Reed-Sternberg cells. So Hodgkin's lymphoma are basically in single group of cells. Single group of lymph nodes. So extra nodal, meaning outside the lymph node, is known as the extranodal, is very rare. So you have, on examination, what you see is there is painless lymph node, which is non-tender, and of course these nodes feel like a rubber ball. So these nodes, when you feel them or you examine them, they are firm plus rubbery. They are firm and rubbery. And they are more common in your mediastinum, so the central part. However, you see constitutional B symptoms in them. What are constitutional B symptoms? So you have, in constitution B symptoms, you have low grade fever, you have night sweats, just like meningitis or malaria, or you have weight loss, low grade fever, night sweats, and weight loss. However, in your non-Hodgkin, they are very rare. Or then you also have pruritus. So one thing you should know, that in Hodgkin's lymphoma, you have bimodal age distribution. What is bimodal age distribution? So the peak levels, like the old age and the newborn levels, like not the newborns, but like 20, their first peak is uh, 20, so it's more common in 20 years old, and second peak is 65 years old. Now, on the other hand, if you see or examine the non-Hodgkin lymphomas, these are basically your B cell lymphomas. And there is extra nodal involvement. So outside your lymph nodes, they can be there. Now, they can be in your GI system, they can be in thyroid, they can be even in your CNS, causing seizures and coma, etc. Now, as I said, constitutional B symptoms include low-grade fever, night sweats, and weight loss pruritus. These are rare in non-Hodgkin lymphoma. And the age group is widely distributed. Widely variable. And these non-Hodgkin's lymphoma they can be associated with HIV, it can be related with immunosuppression, suppressive diseases. So majority involve B cells, a few of them are T cell lymphomas, and can occur in children and adults, and it is more common in HIV and immunosuppressive people. Okay, so the Hodgkin lymphoma are lymphocyte dominant. So they have increased lymphocytic activity. And the least common has the best prognosis. So जो common नहीं है उनमें they have best prognosis. So there are a lot of types like and of course the first type is lymphocytic predominant, which have best prognosis, and they are in young males. And it all depends upon your owl eyes. I said the Reed-Sternberg sign, Reed-Sternberg cells. The more the Reed-Sternberg cells, the more dangerous the non-Hodgkin lymphoma is. And the Reed-Sternberg are binucleated cells with two halves, just like a mirror. Like for example, this is a cell and it's just like a mirror. It is binucleated giant cells, so tumor giant cells. Okay, so first type is lymphocytic predominant, which is more common in young men, and then we have the nodular sclerosis type, which is most common. Then you have more lymphocytes than the Reed-Sternberg cells. Plus, you have bands of collagen. So you have abundant collagen material. Plus, wherever there is collagen, there must be fibrosis and sclerosis. So fibrosis and sclerosis there. Now, you know that I said कि भाई आपका जो men are predominant, men have more non-Hodgkin lymphomas, but in this case, in nodular sclerosing type, the men and the women have the same ratio. Now, what about the third type, the mixed type? So you see there is eosinophils which are predominant. You see this is in HIV patients, and they are the worst because they are undifferentiated, and it is the most uh, dangerous one so far because of the worst prognosis. What about the lymphocytic depleted type? Seen in HIV again or immunocompromised patients. Very poor prognosis. Now, let us jump on to non-Hodgkin's lymphomas. So the most common is diffuse B-cell lymphoma. The most common is B-cell lymphoma. Achha. So usually older adults are involved. Older people are involved, and this is the most common type. And there is a translocation of 14 to 18. Then you have lymphoblastic lymphoma. And of course, you have follicular lymphoma, and you have Burkitts lymphoma. So in Burkitts lymphoma,